Hi, everyone. Happy Wednesday, Wellness Wednesdays. I'm trying to even get my own Wednesday wellness together. We have Dr. Keith Berkowitz with us, and we're going to be talking about it's not you, it's your hormones. So let's try and get Keith in, and we'll get started with our chat. So, everybody joining us today, 80% of women suffer from hormone imbalance. And as we can see, Dr. Keith Berkowitz is tilted out of balance, and he's a man. Listen,
I was trying to find
I
new
know that
position
wasn't that funny.
to avoid technical difficulties. It didn't work.
Technical difficulties. Thank you for joining me every Wednesday. This is a shared Dr. Keith Berkowitz and I, just so you know, we have discussions before we go live, and we want to always give you the best information. So we're very excited. Keith, we know that hormonal imbalance in women is a big thing, and you being a man, I know you see a lot of my patients, and a lot of women go, men don't understand. But if any man understands, it's you, and you're an amazing doctor, and we work really well together with helping women and men with hormone imbalances. Let's start off with, what is a hormone imbalance?
So I always kind of think I like statistics, so I always will start with that. So interesting enough, about 80% of women have a hormonal imbalance. So it's really, which is tremendous, right? 80%.
Yes, huge.
And typically that starts in your 30s or 40s. Whereas in men, it starts later in the 40s or 50s. So what it means to have a hormonal imbalance is to have hormone levels that are not in sync. And we think of our typical hormones, we think of estrogen, progesterone, testosterone. When either in relation to each other, progesterone's low or estrogen's high or testosterone's low, that's an imbalance. Everything has to be in sync. It's like a concert. I love that term you use every time. So, and that's the key to all this.
So if you guys have a question, make sure you hit the question button, and we'll answer your questions at the very end, because we're going to have, about 15 minutes of chat and I think 10 minutes of question and answers. So just so you know, we're not keeping this one super long. They're going to be shorter, but we're going to give you more time to have question and answers. So when the symphony is wrong, that's when things can go wrong. And what I like to explain to patients is that think of hormones as messengers, right? So say FedEx or UPS right now, it's going crazy all over the world. I'm sending products to Europe and they're not getting to Europe. They're going somewhere else because the message is not communicated properly. And that's what hormones do, is they're like your FedEx or your UPS of your body. And if that message doesn't get sent properly, what happens to the cell, Keith? Right? The cell can't function. And so people get anxiety.
Right. It's so interesting about sex hormones. We don't think that they have roles outside of, sex
Yes.
drive,
Yes.
your menstrual periods, but they actually affect other cells. Everything, again, works because it is part of your bigger picture, which we call the endocrine system. Right. And if you actually look at studies over time, people with low hormone levels actually age prematurely. Right. And I know you always talk about the skin. Hormones are so important for maintaining proper skin and prevent the body from prematurely aging, right? We all want longevity at the end of the day.
And, people, when you get into your 40s, like myself in my late 40s, estrogen levels decline, progesterone levels decline, testosterone levels decline. Estrogen equals memory. Estrogen equals eyesight. So all of those things start to change. And you start to get memory fluctuations. You start to get fatigue and all of those things. But we're here to tell you how to modify that and even what blood tests to do. And I'm gonna post them all in my stories so that you can go back to your doctors, because we're unfortunately not your doctor. I wish we could be. And of course, you need to work with your doctor to make sure that they run these tests for you, which we'll go into a little bit later. And I promise you, I'll post them. Are you there, Keith?
Yes,
you keep pausing
I think coronavirus has affected my Instagram. So people need to get out so that we have less wireless being used. So, but in a sense, that by actually knowing all these things, you can build a foundation. Without knowing what your levels are, it's hard to make a diagnosis and actually to fix things appropriately.
A lot of the time we can understand if you're in your late 30s or your late 40s, and we can see patterns and symptoms of hormonal decline. We can always, as a naturopathic doctor, I use a lot of botanicals. And I will always start with botanicals first and fix the gut first. And then I will go to the bioidentical hormones thereafter, especially if you're in your late 40s and early 50s. That is something that I highly recommend. What causes hormone imbalance? And we know this is people that are put on birth control pill, for example, Keith. You know, I have a lot of patients that have been on birth control, and then after their birth control, their periods are irregular. There he is.
Right, because what people forget about birth control pills, it's often one type of estrogen. And what people don't really realize is our body actually makes, a female body, I should be clarified, makes 3 different types of estrogen: estradiol, estriol, and estrione. So when we're giving birth control, we're not actually giving physiologically the way we're supposed to treat hormones. And that's really critical. And oftentimes people think that a lot of the side effects people are developing, including risk of cancer, comes for that reason.
Exactly. When you're favoring only, remember, you have 3 types of estrogen. When you're only favoring one estrogen, the other ones get left out. And you have to look at it this way: they metabolize into different parts of breakdowns of hormones. And that metabolism of the hormone is super important. If they metabolize into something bad, then you could have an excess buildup of what I call dirty hormones. And then also, if they don't metabolize well, then you're losing out because you don't have enough B12, folate, and other B vitamins.
So if you want, I can break down the 3 different types of estrogen. So we think about it, the most common, we think of estradiol. So actually estradiol is the most common that we think of in women. When we actually take hormonal replacement therapy, it's almost always an estradiol type of a component. Then there's estriol. Estriol is actually the kind of estrogen you often see with pregnancy. That often goes up with pregnancy. And what's interesting, that may actually be protective against cancer. So that form of hormone. And then there's the third one, estrione. Estrione typically is low up until menopause. And as that rises, we think that has a correlation with actually risk of cancer in the long term.
Exactly.
So that's probably your most dirty of the hormones.
That's the dirtiest of the hormones. Exactly. And, you know, also, Keith, you know, we want to explain to everyone, you know, how do B vitamins work with not only just hormones, but the depressive-like symptoms that women get from hormonal decline. You know, and somebody just commented here that a lot of doctors are quick to put their patients on antidepressants because they can't figure out what's going on with them hormonally.
Right. So it's interesting. Again, so there's obviously B vitamins are a big group. So one of the biggest aspects of B vitamins is when your body's stressed, that's one of the first things you deplete. So again, when you deplete stress, guess what your body's going to sacrifice first? I always think of, I use the generator model, right?
I like that.
You have a generator hooked up. What's it going to support first? It's going to support the brain, the heart, the lungs. What's going to be missed is actually your sex hormones, ironically.
Sorry, just plugging in my computer.
Yeah, I think coronavirus is everywhere today. And because of that, it's so important. And again, in women, let's give example. You know, there's women who have excess testosterone. One of the treatments that has an effect is actually B vitamin known as inositol. So inositol can be effective in helping with estrogen metabolism and actually preventing some of the estrogen from becoming testosterone.
Exactly. And these B vitamins also, I know, Keith, you love this, work in a level of symphony. You know, you've got B1, which is thiamine, B1. Yes, Be Famous is going to be available in 2 more weeks, I promise. I created a B vitamin that has all these great vitamins in there, but still not available. B1 is quite often depleted when you drink too much alcohol. And also we've seen thiamine be reduced due to the fact of stress, which all of us have been going through. And then B2, riboflavin, B3, niacin, B5 is hugely deficient in people who are burnt out. Your adrenal glands, which are the glands that sit on top of your kidneys, deplete B5 first. and then B12, as we know, for cognitive function, and then folate. So all of them work together in a symphony. And actually, if you only take one of the B vitamins, Keith, what I've found is that people become deficient in all the other ones. And it can affect you neurologically, in a very small way, but it's super important to take all the Bs together.
And again, stress. I mean, we always talk chronically about stress. That's the key to almost any function in your body. So when your body's stressed, you don't have enough fuel to run the processes you need. And one of those processes is actually production of sex hormones.
Right. Yes. And that, and a lot of people think of libido, right? Which libido is impacted. That's the first thing that goes when you're stressed out. Well, for most people, anyway.
I love the question of libido because I always ask, people when they come in, which sex hormone has the biggest impact on female libido?
Oh, really? And what do they say?
People say, oh, estrogen, progesterone, but ironically, it's actually testosterone.
Right.
So testosterone has the biggest effect on libido and actually on arousal. So interesting enough, a typical hormone we think of as a male hormone has such a dramatic impact on our sex life and our desire for sex as well.
So testosterone, to take or not to take for women?
So it's so interesting. It's a great question. So and I always kind of look at it this way: is what's the true deficiency? Is it truly a testosterone deficiency, or is it a hormonal imbalance? So, and what I mean by that, so if you're estrogen dominant per se, right, and your body wants to make more estrogen, if you actually feed more testosterone into that system, you actually may only end up raising the estrogen and may not accomplish what you want to. What I think is more important is to figure out, okay, where is the imbalance? Is it low progesterone? Is it low testosterone? Is it low estrogen? Are all the hormones low? Again, that's a different treatment than if there's a relative decrease in hormones. And again, we talked the last couple of weeks about thyroid having an impact on hormones. Is it underactive thyroid? And your favorite one, is it a digestive issue where you're not absorbing fat and you can't make hormones from that aspect? Or is it a mineral issue, right? Where you don't have the substrate, and we could talk about that a little later, to make some of these hormones. And is that the issue?
Exactly. And when people, if you notice when people are most stressed, you can tell that they've aged. And that's because your hormones have declined, because your adrenal glands are about 30% of hormone production. So super, super important to keep your adrenals optimal during the time of stress, and B vitamins are one of them. What other causes of low testosterone, Keith?
So one of the big ones is environmental. I think one of the things we're seeing more and more is all these environmental stresses. I mean, we talk about plastics, and estrogen is a common thing we talk about, diet. Another one, which is people don't always think of, is over-exercise. That people over-exercise, they actually deplete all their sex hormones. And everyone's heard of stories that athletes, when they overdo it, can sometimes, stop their menstrual cycle because of depletion. That's really critical. And sometimes medications can have an effect as well, too. One of the ones that's common, we keep on bringing up week after week, is the statin. Cholesterol is actually your precursor to your hormone production.
So we need cholesterol, guys. Yes.
My favorite study on cholesterol, I don't know if I mentioned this last time, is they did a study on people over 85 and under 85. And they turned out that people over 85, that cholesterol is linked to mortality. So people with the low cholesterol actually died much sooner than people with the high cholesterol. And the author's take on that was, okay, stop checking cholesterol at 85, but 84 you need to treat.
I find it hilarious. And I always look, and the other research that I looked at is 50% of people who die of a heart attack have normal cholesterol. So cholesterol is not the whole story, but it was just, one of the ways in which drug companies would get people to get on medication, because it's a multi-billion-dollar industry. Anyways, cholesterol is a good thing. We need cholesterol. It's just when it goes dirty, when it goes bad, that it can deposit in the arteries. And only can it deposit in the arteries when the arteries are themselves not protected, and there's not enough antioxidants supporting the vasculature, right? So correct. The intima, the layer of the blood vessel, the endothelium of the blood vessel, which is super important because nothing can lodge there if there's no plaques or any scar tissue. So we have to look at the root cause first before we do anything else. And we need cholesterol. It's a good thing for our sex hormones.
But you know what's so interesting? We talk about supplements week after week.
Yes.
And what's interesting about it, it's the same ones in a lot of cases, right? It's the same
Right.
basic ones. It's vitamin D, it's magnesium, it's probiotics, that over and over again, that these supplements have such a tremendous role in good water, right? High pH water helps too.
Yes.
And that all plays a role in making the systems work. It's so interesting. Your hormones, your blood sugar, your thyroid, all really depend on the same underlying substrates.
Right. It's super interesting. And for those of you listening now, we're gonna take some are we ready for no, we still have more to go. Keith, think about your questions, guys, because and you know, and please, some of you guys have posted them, so this way we can answer them. Is there anything else, Keith? I think we should talk about what you can eat for your hormones, because a lot of people are, you know, have gone off the wagon. They've been, you know, including myself. I was one of them until I did my cleanse. But I think it's super important for people to know, like, what can they be eating to clean their hormones? And obviously, I know you and I both agree on all these foods, but I'll let you talk.
So one of the things is, again, it goes back to clean eating, right? One of the key things is proper digestion, is eating non-processed foods, because we know certain foods have a problem. Yeah. And again, so when we think of food, we also want to think about estrogen dominance. And I think one of the things, you know, that is important is that more and more we're seeing women with estrogen dominance. And what estrogen dominance really means is that there's excessive levels of estrogen in comparison for both progesterone and also testosterone. So in those cases, you want to avoid foods with too much estrogen. And so two of those, you know, when we think about this, especially with fertility, is things like peanuts, right, can be problematic. And also, sorry about that, I don't know why that's happening. So red wine and beer all have that effect. Those can all have a big effect on that. The other things you want to think about is things that support things like progesterone. So progesterone is supported by foods that have magnesium. Things like walnuts are really good. Pumpkin seeds, I know you love those, Nigma. And yes, also
high in zinc
my
as
favorite
well.
too, which help actually support also testosterone, are things like lamb and scallions. So when you look at Chinese medicine, they always talk about how can we help fertility. It's lamb and scallions. So that's what I'm having for dinner tonight.
You trying to have more kids, Keith?
I think 4 is definitely not enough. But again, those are important. And again, but also watching your blood sugar becomes a big thing, because when you develop insulin resistance, and that happens a lot of times when you consume foods that raise glucose, that also has a negative impact on your hormone production. Again, we talked last week about cortisol, and cortisol is affected, you know, when glucose goes up, and glucose needs to, but people don't realize your precursor to making cortisol is actually progesterone. So you want progesterone to act as a sex hormone and not to act as a precursor to make cortisol.
Exactly. Ah, so well said. Also, you know, people drinking out of plastics, which, you know, is also going to contribute to estrogen dominance.
Right, and you get xenoestrogens from that. That's really a big problem, and that's been seen more and more as a problem. And we're seeing, and where we're seeing is where women's weight gain patterns have changed, right? Where weight gain is often around the abdomen, where traditionally when you and I grew up years and years ago, that it was more in the hips, the thighs, the buttocks, and that's been a change in hormone levels because of that.
There was an interesting study that showed that 2 groups of women ate the exact same diet, and one group of women had a lot of plastics, you know, in their household. And the group that had the plastics in the household actually gained the most weight, in terms of we're not able to lose the weight. So we know that when we're looking at weight gain, it's not just your diet. Your diet could be the cleanest diet in the world, but if you've got a common denominator where you've got like a lot of xenoestrogens, these guys disrupt your estrogen, your hormone messages, and they disrupt the FedEx or the UPS messages. So, you know, make sure that, you know, you're looking at all of that before, you know, not just diet, but you're looking at what you have in your control in terms of your environment.
And you mentioned before, like estrogen is not only produced in the ovaries and the adrenal glands, but also fat cells. So what people forget, that estrogen is actually a fat storing hormone. So as you develop more fat stores, it makes more estrogen, which makes more fat stores. So that is really, that vicious cycle. You really want to stop that. And balancing out those, I love that term, dirty hormones, is the key, so that your progesterone levels are in sync with your estrogen and testosterone levels.
Exactly. Now, some of the cleansing foods, we look at cruciferous vegetables, right?
Mm-hmm.
So Brussels sprouts, broccoli, cauliflower, all the stuff that your mom wanted you to eat when you were growing up, and you'd sneak it under the table and give it to the dog if the dog would have it. I don't know if the dog would eat it, but those vegetables clean out your dirty hormones. Remember, Keith talked about those three types of estrogen: estrone, estradiol, and estriol. Those all work on metabolism. They all help those hormones metabolize so that they don't go dirty and they don't send the wrong messages.
So you said, so interesting about cruciferous vegetables is we talk about one of the supplements we use a lot to help balance out hormones called DIM.
Yeah.
And DIM is something that works by actually blocking what we call an aromatase enzyme. And aromatase is kind of interesting. If you look at treatment for breast cancer, one of the treatments, and it's a synthetic version to prevent recurrence in menopausal women who develop breast cancer, are what we call aromatase inhibitors. DIM actually does that naturally. And one of the things it does is actually prevents that estrogen from becoming testosterone. And so in people with things where we call high testosterone states, for example, polycystic ovarian syndrome, that's really important in preventing that from happening.
Huge. And then the other one is milk thistle, because milk thistle, it's not milk, so you're not going to get dairy face from this, don't worry. Milk thistle it hugely helps metabolism of hormones. Your digestion, when you go to the toilet, you 100% clear estrogen out of the body. That's the only way it comes out. You pee it out, you poo it out, and you sweat it out. Now, pooing it out is optimal. It's so important. And milk thistle really, really helps with phase 1 and phase 2 detoxification. So part of proper hormonal metabolism is also dependent on how optimal your liver is of clearing these toxins.
I always think of milk thistle as a broom. So it's the broom that sweeps away everything that's shouldn't be there. And again, one of the keys, and I think we always think of when we want to treat hormonal imbalance, one of the first steps we think about is not necessarily supplementation first, but actually preventing what shouldn't be there and getting rid of excess. And that's always important, because by getting rid of excess, sometimes that alone restores balance.
Absolutely. Probiotics. Probiotics is super important. And I've seen in my practice, when I put somebody on probiotics, that's another way of fully detoxifying and getting rid of. See, what happens is a bad bacteria in the gut, if they don't have any good bacteria to tell them to go bye-bye, what happens is they start to ferment and they cause inflammation, and that causes hormonal fluctuations. So probiotics.
Yeah, so it's interesting. Yeah, probiotics actually are required for metabolization of your hormones. So to be able to absorb them, you need actually a proper probiotic mix of good bacteria.
Exactly. Then we have turmeric, which I grew up with. Why don't you take the floor on this, Keith? I love turmeric.
That's why I threw it in, by the way.
Yes.
So turmeric is actually a very strong antioxidant and actually helps. Remember, one of the things about and prevents inflammation. When you have inflammation, that also depletes resources. And by depleting resources, again, we talked about that generator model, right? The generators are going to support the things that are most needed first. And unfortunately, to everyone, it's not your sex hormones. But so by actually decreasing inflammation, you make the body work more efficiently. Your hormone production actually will be better. And there's even studies on turmeric that were done on breast cancer, where they did studies where they added turmeric to a chemotherapy drug and watched it versus the chemotherapy drug by itself. And actually the people that took both together actually had much lower rates of recurrence. And the cancer actually decreased dramatically in that group.
And, I've been using turmeric since I was a kid. My grandmother would give it to me in a teaspoon with honey and make me take it down if I had a cough, because it really works as an anti-inflammatory. So it's amazing that we're now using all of these things that we use in our cooking, Indian cooking. So the other thing I wanted to talk about is vitamin D and hormones. So, because vitamin D is a pro-hormone. So talk to us about vitamin D, Keith.
I feel like every week we talk about vitamin D, right?
We
For
have
every
to talk
topic
about
we're
vitamin D.
discussing. And very appropriate for the summertime. So vitamin D has an effect in actually your body's ability to make your hormones. That actually it's been shown with inadequate vitamin D levels, you actually cannot metabolize and make your hormones appropriately.
Yes.
So they've actually correlated, actually in men and women, low vitamin D levels with actually testosterone deficiency. So to maintain proper arousal and sex drive and libido, very important as we discussed, you need actually appropriate vitamin D levels.
I literally have tested thousands of patients, and so have you. And 80 to 90% of my patients are vitamin D deficient. And actually, the darker your skin is you need to be even more careful of a vitamin D deficiency, because those are the people with those polymorphisms that quite often have those inability to convert the VDR genomic polymorphism that I see quite often in darker skinned people like myself. And so I constantly need to be taking vitamin D, and make sure you're taking a vitamin D with K1 and K2. And do you want to talk about the K1 and K2, Keith, and why it's important?
Sure. I mean, so K1 and K2, and again, remember one of the keys to it's actually vitamin A, E, D, and K, your fat soluble vitamins we always talk about. And what's so critical about that is that you actually have trouble absorbing them. They're much harder to regulate. So actually that's why we have to supplement. The problem is if you supplement one in high levels without the other, you deplete the other ones. And K1 and K2 are so important for maintaining proper what we call endothelial function. So you talked before about endothelial function, which is the outer layer of cells that keep the body elastic. So in order for your blood sugar to be regulated, to prevent heart disease, K1 and K2 are so important. Also for bone health, they're very important, and for actually preventing bleeding as well.
Exactly. And K1 and K2 actually take the vitamin D and put it in the bone versus keeping it in the circulatory system, because we know vitamin D increases the absorption of calcium. And so if you have too much calcium hanging around in those endothelial cells and the arterioles, in the arteries, you can have potential calcium blockages. So it's a safer way to take vitamin D with K1 and K2.
It's so interesting. People talk about supplementing calcium all the time. The problem is without adequate vitamin D levels, that calcium becomes actually pro-inflammatory. So it actually becomes a problem rather than a helpful thing. And can I bring up vitamin E too, since we're on the topic? So vitamin E is really interesting. So one of the things we're learning more and more is women's breast tissues changing over years. We're now seeing that people developing what we call more fibrocystic breast tissue, which is happening more and more. It's when I did my training back in the early 90s, we rarely saw this. Now, when people go to get mammograms or ultrasounds, this is the much more common pattern. And it turns out vitamin D is really important for that function, to actually prevent that. And that's critical because that could be a risk factor later on for breast cancer. Also for liver detoxification and liver repair, vitamin D is very effective. Vitamin E, excuse me, is very effective.
Vitamin E.
And actually, I'll bring iodine. Should I bring an iodine?
Yes, I was just gonna see. We're like two twins. We're twins. Two twins. We are twins.
But I wish I had your hair. We'd be better.
And my makeup as well.
You promised you would share. But so what happens is, there's really interesting, what I've learned in practice and we've done reading, is low iodine levels is very much tied to actually cystic breast tissue and very dense breast tissue. So we find that correlation, and we're learning more and more that more people have low iodine levels, probably because of the fluoride in the water. So again, what I've seen in practice is when I've looked at mammograms and ultrasounds of women, that it really correlates directly with actually low iodine. You see much more dense tissue the lower the iodine levels are.
And, you know, ladies out there, I've experienced this myself. I have very dense breasts, not that you need to know, but you do need to know, so that you understand that, you know, when I started taking iodine, you know, I had all these fibrocystic changes in my breast tissue, and I do regular ultrasound screenings, not mammograms, just because I have a family history of breast cancer. Now, it's important if you have a family history of breast cancer. It doesn't mean you're going to get it, but it's good to be aware. And especially if you have fibrocystic breasts, it's good to do self-breast exams and sort of get to know your breasts. And if that lump was there before and it's there every month, then that's something you should look into. But what I found is when I take the iodine along with vitamin A, C, E, zinc, and selenium, it's a massive improvement. And there's, you know, a lot of women with breast changes or pain before their cycle, these things go away because of what Keith said, the iodine issue. And very few doctors, you know, say this to their patients. A lot of them will just say, get off the caffeine, which is definitely true. But an iodine deficiency is always almost the case in this particular situation.
And actually, it's interesting. You see now, pretty much almost all women now get not only a mammogram, but they get an ultrasound because of that dense tissue. Whereas when I first started my training in the 90s, that was very unusual. People would only get a mammogram. But because of the increased density, the mammogram is not able to see lesions underneath, and that's one of the reasons. You mentioned zinc. So zinc again, right? Isn't it interesting? You need zinc to make testosterone. So zinc actually is important for testosterone production. So you need zinc not only for things we talked about thyroid in the past, but also for testosterone.
And it increases sperm motility. So any of you men out there trying to get your ladies pregnant, get on some zinc. Okay, so we have fenugreek. Oh, I'm obsessed with fenugreek. Let's talk about fenugreek, and then let's go to the questions that people have asked.
So fenugreek, actually, you know, we've talked about it before. It has a role in insulin resistance and helping blood sugar, but it also helps the enzymes that actually prevent testosterone from becoming estrogen. So it's really important, because what happens is, and actually if you look at risk, and this actually applies to men as well, you know, years ago they used to say how high testosterone was a risk for prostate cancer. But it turns out in people that have testosterone that becomes what we call aromatizing to estrogen, that's a problem. So fenugreek actually prevents that process from happening, so that the testosterone you have actually remains testosterone.
And it increased libido in the studies by 80% and improved sexual performance by 66%. And you can actually eat fenugreek, and you can, you know, include it in your I don't know, your salads or whatever way you want to do it. But there are supplements out there that obviously are more standardized, and you know, about 500 milligrams a day of fenugreek, right, is what we recommend. Perfect. All right, and it's fenugreek, FenugreeK, and it's not Greek, it's fenugreek. Get it together. All right. I mean, we have so many other supplements to discuss, but I really, really want to get into the questions here, because you know, a lot of you have been waiting for this live and been waiting for questions, and I want to be able to ask them. Okay, how do you get your hormones in balance? Do you need to be vegan? Well, I'm going to answer that question. You do not need to be vegan, and in fact, you know, it actually is really difficult to be a good vegan. So that you discuss with your nutritionist or your naturopathic doctor, because I'm not your doctor and I don't know. Sorry, I've just got some dog fur in my mouth. My little dog's come to sit with me. He's here asking answering the Q&As. The issue being vegan is the protein issue. And I don't want to get into a huge debate, because this could be like its own Instagram live. You don't need to be vegan, but you do need to make sure that you control the amount of meat that you're eating in your diet, which can increase your estrogen dominance. Both Keith and I have written a book. Obviously, we're going to suggest our books, and I can post them on my Instagram. I have a really good way of eating to clean out your hormones. So I can post that for you after, the one person that asked that question. But it's a good question. Keith, what type of vitamin is best? I hear conflicting on tocopherol versus tocotrienol. What type of iodine is best?
Oh, great question. I'm not sure I know that full answer to that one. Actually, you know what? I will post that answer. So let me before I answer that fully, let me post that. That's a great question.
But there is conflicting information on vitamin E and the different types of tocopherols. And we can post a study for you, because for us to give you an answer on that, a lot of studies are mixed, and a lot of studies are done in a way that I don't agree with. I think it's utilizing a combination of different tocopherols that have been known to work more effectively. And then your second question is what kind of iodine?
So oftentimes people will supplement iodine in the form of kelp. And again, you want to be careful with iodine as well. If you have a thyroid issue when you're on thyroid medication, iodine can impact thyroid levels. So you want to be careful.
Yeah, absolutely. All right, let's go to our next question. After pregnancy, I now have growth of awful facial hair, a mustache, and chin hair. What can this mean and the best ways to improve?
You want me to take that?
Sure.
Okay, so when we think of, we use the word hirsutism, right? So it's abnormal hair growth. Thank you. You got to
Hirsutism.
Thank you. Hirsutism. This pronunciation thing doesn't work well for me.
It's too much COVID information overload. That's why you're doing a lot of research on COVID. So that's
so
why.
what it is that actually typically is actually a testosterone overproduction. And it can also be a DHEA or for overproduction. So you have to look at, risk factors. Typical risk factors oftentimes for that is insulin resistance. Typically, if the weight of the baby was high, almost 10 pounds, chances are there probably is insulin resistance in the mother. So what happens also post-pregnancy is your hormones may not recover properly, where some of the estrogen progesterones may be low. And if you have a tendency towards testosterone, that may be higher as well.
I would also, if I were you, get a scan with your gynecologist and make sure you rule out polycystic ovarian syndrome. And if you have any cysts on your ovaries, a lot of the time they say there's nothing you can do about it, but I promise you there is so much you can do about it. And, Keith and I can even do like a separate IG live on PCOS because it's such a vast topic. And, by the way, you guys, send us messages of what you want us to talk about because every Wednesday we're going to be doing Wellness Wednesday. So it's up to you to let us know what you want to hear because we're here for you. We've dedicated this time to answer all of your questions. Let's see. We've got another question here. Can you offer a little advice on leaky gut, chronic inflammation? I'm already gluten-free. Okay, so we are going to be talking about next week. Keith, do you want to tell them what we're going to be talking about? And maybe we can.
So next week we're going to talk about small intestinal bacterial overgrowth and its relationship. We can talk about with gluten as well, and how a lot of people talk about celiac actually may be a bacterial overgrowth syndrome, and that actually people did not, in a lot of studies that were done overseas, people did not get better with a gluten-free diet by itself, but required actually treatment of their underlying bacterial overgrowth. And often fungal overgrowth as well.
Exactly. So next week, we're going to be talking all about that. So thank you for your question, but I think we're kind of out of time here, and I would love to utilize next week. Next week, we're going to be talking about SIBO, small intestinal bacterial overgrowth, and we're going to talk about leaky gut with that, because you can't talk about SIBO and not leaky gut. They go hand in hand. So join us next Wednesday. We will be here at 11 a.m., 2 p.m. Eastern Time, 11 a.m. Pacific Standard Time. And we look forward to seeing you. Let us know if you enjoy these lives. We'll continue them. And we love having you guys. And I love having this talk with Keith because, we're talking all the time, but we'd rather talk with you as well.
Absolutely. And again, be safe. Be careful in this environment, please.
All right. Giving big kisses for Wednesday. We'll see you next week. Be here, be there, or be square.
Thank you.
All right. Bye.
Bye.